Bismillahirrahmanirrahim. Today we will try to discuss about the methods of closing the space in between teeth or interdental space. At first, we can have a look at the causes of this spacing at a glance. Among those causes, the mentionable are genetic, finger sucking habit, abnormal jawbone growth, size and shape of teeth relative to the jawbone, gum diseases, and oversized labial frenum. Labial frenum is the tissue which connects the lip to gum. We can divide this interdental spacing into two types. One is the central, that is at the midline of jawbone. It is also known as the midline diastema. And another one is the spacing in between the other teeth, that is generalized spacing. We can close this interdental spacing by three methods. These are the cosmetic method, orthodontic method, and the method of attaching the artificial teeth. Now we will try to discuss about those methods elaborately. At first, the cosmetic method. In this method, we can close the gap by light cure composite filling materials or composite filling materials. For example, if we look at this picture, the spacing in between these two teeth is 2 mm. Then we can divide the 2 mm space into equal half, that is 1 mm and 1 mm, and making light cure composite filling materials of 1 mm to each of the teeth, increasing the width of the teeth by 1 mm and closing the interdental spacing. If we try to look at the patient's mouth, then this interdental spacing was closed by light cure composite filling materials. This patient was also treated by cosmetic method. Another way of filling this space is by preparation of cap. We can prepare the adjacent tooth of the spacing to be filled by cap. That is, we can prepare the adjacent teeth by root canal treatment and give the cap cut and then take impression with the including the spacing and then insert the cap and close the gap. Another way of treating this interdental spacing is by inserting bridge. In this method, we can prepare the adjacent teeth by root canal treatment and cap cut, then adhere or add the cap of the same size of spacing with those two cap and insert the three cap at the same time and close the gap. This is known as the bridge technique. Another way of cosmetic method is by implant. In this case, we insert a screw to the bone at the free space and then prepare an artificial tooth on that screw and close the gap. Another method of treating the interdental space by orthodontic treatment. In this case, we attach the bracket and wire on the tooth, and by gentle and continuous pressure, we bring the adjacent teeth together in contact of them and close the interdental space. In this case, we also did the same treatment and close the gap. In case of this patient, we did the orthodontic treatment and closed the gap. In case of this patient, we have also followed the same treatment procedure. In case of this patient, we did the same. In case of this patient, we have also followed the orthodontic treatment and close the gap. Within the orthodontic treatment, another way of treating the interdental spacing is by wearing clear aligner. In this method, we close the gap by wearing the clear aligner step by step. Another method of closing the interdental space is by attaching artificial teeth. For example, in case of anterior teeth, we prepare the same size of spacing the artificial teeth and attach the artificial tooth to close the gap. In case of posterior teeth, we did the same. During the treatment of interdental spacing, we may need to do some related treatments like the frenectomy. It is the process of surgical removal of the labial frenum. In case of this patient, we did the frenectomy and then applied the orthodontic procedure and closed the gap. In case of this patient, we have also removed the frenum by frenectomy and closed the gap by light cure composite filling material. We may also need to treat the gum and remove the calculus of the teeth by scaling, and we have also need to treat the other diseases of the gum. During this treatment, we need to consider some points like size of the spacing. If the spacing size is little, we can follow the cosmetic procedure. On the other hand, if the spacing is more or more than one spacing is present, we can follow the orthodontic procedure and close the gap. We may need to consider the overall teeth condition, that is the surrounding teeth condition, the bite alignment and the jawbone condition. We may also need to consider the aesthetic goal and cost and treatment time. For example, if a patient has less time and money, we can follow the cosmetic procedure, that is we can close the gap by light cure composite filling materials. On the other hand, if the patient has more money and time, we can advise them to follow the orthodontic treatment procedure. In this way, by finding the exact cause of the spacing and selecting and implementing a suitable treatment procedure, we can close the interdental spacing and increase our desired beauty. Jazakallahu ta'ala khairan.